Okay. All right. Hi, everyone. Nice to see you today. I'm Erin Martinez. I'm the program manager for the Patient Navigator Training Collaborative, and we've partnered with the creators of this lung cancer screening toolkit to host it on our website. And I just want to share this great resource for you today. It's recently launched within the last 6 months. So we're really working on getting the word out and letting people know about this great tool. So this toolkit is called a roadmap for patient navigation. So lung cancer screening patient navigator roadmap. So that kind of encompasses what the goal of this toolkit is. It's designed to be a guide, a map to help you implement lung cancer screening in your practice or your clinic or community organization. So I just want to acknowledge all the people who really went behind to develop this toolkit, because although PNTC has been involved as a partner to promote, I don't want to take any credit away from these people who have put in a lot of hours. The lead developer was Aaron Hirsch at the Colorado School of Public Health, and under the guidance of Dr. Betsy Rizendahl with the School of Public Health and the University of Colorado Cancer Center. And it was funded by the Lung Cancer Research Foundation. So just want to throw that out there. All these people have come together to really create this resource. All right, so just a quick overview. We have how to use navigators in a lung cancer screening program, what that looks like, evidence-based strategies to address screening barriers and disparities, lung cancer screening program setup tools. So there's a lot of things to download and look at. And then tips on integrating smoking cessation into screening programs and what that might look like. And then this toolkit has a companion course. So I would say the toolkit's really good for those program managers and those who are looking to implement the program and really get those nitty-gritty tools. And this course is really, really good for the navigators themselves to get experience in and background in what is lung cancer, how do I identify patients, and how do I address specific barriers to lung cancer screening. So it's a self-paced course. It takes up to 5 hours, so it is very comprehensive, but you can go in and out of it as much as you'd like. So you can complete it on your time and really get that background knowledge. So what I really love about this course is that there are some really thoughtfully developed case studies that you get to apply the knowledge. So the different topics include a role of a navigator, how you find patients, and how to determine if they're eligible for lung cancer screening, different decisional support tools to help them go through that process if that is right for them, smoking cessation information, and follow-up. So those are just a few of the topics that you can really dig into on these. I attached a screenshot of the case, one of the case studies. But I really like that applied knowledge because I think it makes it real. You get to learn about these clients or patients, and then really get to apply the different skills through interactive quiz forms and learn more about the clients and these different topic areas. So I'm just going to take you on a real quick tour from our website. So let me stop share and then reshare our website. Okay, so this is just our homepage, patientnavigatortraining.org. And we have a link right on our homepage. So featured content, lung cancer screening patient navigator roadmap, and just access toolkit now. And it's also a pretty simple URL, lung cancer screening toolkit right up here. So that'll take you there. And this is just an overview. And we have a lot of different ways to engage with this content. So there's these little tiles, and if you click on, as you can see, there's 6 distinct chapters, and this was created so whether you want to implement a full lung cancer screening program using patient navigators, or maybe just pick and choose a few pieces that work for your practice, you can do that. You can click on, let's see, we want to learn more about the role of patient navigation, and then it'll open up a PDF, and you can download that specific chapter. And if you would like to download the whole comprehensive toolkit, you can do that here as well. We just ask for a name and email, and then you'll get access to that full resource. So the creators of this toolkit really wanted to make sure that individuals could go straight to the information that they needed and be able to utilize those tools. So if you scroll down, I'll show you the course in just a minute. So if you don't even want to dig into those PDFs, you just want to look for some quick tools, there's a list here, and these all take you to different documents to download. So these are tools like billing and coding, follow-up checklists, patient navigator roles, and eligibility checklists. So really nice job aids if you're just looking for that. And then resources, obviously lots of options there to go through and determine what's best for you. Right, so the companion course is located on our e-learning site, which is free to sign up. So take course now, we'll take you there. And so this is on our sub-site, which is patientnavigatortraining.org e-learning. And one of our, we have about 10 courses now that are all free with registration. And as you can see, these are all the topics. Like I said, it's fairly comprehensive, but it really, I think, engages the learner with those case studies in different ways. There's videos, there's little quizzes, and different ways to learn about the material. And you do get a certificate of completion at the end. So that's a nice thing. If you go through and really engage in this knowledge, you earn a certificate. So I want to point out that there's a long detailed description, but if you want to take this course, it's all the way down at the bottom. So it's kind of hidden here. I just always want to point that out to people. Fortunately, we couldn't get the button to go up higher. So, and then that takes you to the registration, and you can take the course. All right, so I won't, I think I'm about at my time. So I just wanted to see if there were any questions and can go from there.
Thanks, Erin. And yeah, she's going to have to hop off. So if you have any questions about this one, get them in now.
Yeah, and I can keep an eye on the chat too, and I'll put my email in the chat. And if you are going through this material and you find that you have questions and I don't know the answer, I can connect you with someone who does. So.
Erin, I have a quick question. I mean, obviously this was kind of designed for patient navigators, but do you feel like for other clinical staff and folks that are interested in learning more about lung cancer screening, it could still be a good tool for them?
Absolutely. I would say all the way from patient navigators to nurses to physicians, anyone who is involved with creation of a lung cancer screening program or any sort of implementation could benefit from the content. And that's why it's designed that you can just download the individual chapters that might apply to you and relevant to you. So I would say absolutely. And for many of us who are familiar with the patient navigator role, others in the practice may not. So it makes a good case on why are these individuals well suited to guide patients through this process, and what is their workflow and what does that look like? So, you know, really lays that out. That's in a clear and easy to understand and shows the evidence base on why it can be successful. Oh, that's a great question, Missy. I don't have one now, but I could certainly create one. We've just been sharing the link straight to our website, but so I don't have a flyer, but I could create one. Yeah.
Thanks. I can just share the web.
Yeah. Thanks, Elsa.
Awesome. All right. Well, thank you, Erin. And yes, if anybody thinks of any questions, she'll be here for 15 more minutes and then, or maybe 10 minutes, and then we can also follow up later. And I just want to call out, I was looking at where everybody is coming from, and we have pretty much the whole state covered. We have someone coming from Grand Junction all the way over east to Cheyenne County. We have the San Luis Valley, and then we have Missy representing the North. So we have a very diverse geographic audience today. So thank you all for being here. So Elsa, I'm gonna turn it to you now to go through yours. And then we'll go on to Allie. Thank you again, Erin, for being with us.
Thanks, everyone, and thanks, Erin. I'm just gonna pull up my slides. Can you see the full screen of my slides?
Yes.
Great. Well, hi, everyone. I'm Elsa Weltzine, and I'm the Senior Program Manager for the Colorado Cancer Screening Program based at the University of Colorado Cancer Center and School of Public Health. And today I'm going to be focusing on toolkits for sustainability planning, specifically for patient navigation and cancer screening. And I did want to give a shout out to our program director, Andy Dwyer, who was an integral driver in leading this work, but she is out on maternity leave and was unable to join us today. So I think everyone on this call is pretty familiar with patient navigation, but since that is the focus of these sustainability toolkits, I just wanted to mention that patient navigation is focused on reducing health disparities in a particular community and addressing patients' individual barriers to care to help get them to screening services and follow-up services, and is really based on a team-based approach. So the reason we need to focus on sustainability of patient navigation and utilize planning tools is that the evidence base for patient navigation in primary care and other clinical settings is very strong, but as evidenced in the literature, but as this evidence base continues to build, the grant support for patient navigation is slowly diminishing. So it's really key for clinics and other community-based programs to think about how they can build capacity and start to make the business case to maintain these services for cancer prevention and other evidence-based clinical practices. So there's a number of sustainability planning tools that are available to help with examining current capacity and providing guidance as programs shift into long-term practices and procedures. So one of these tools is the Paying for Colorectal Cancer Screening Navigation Toolkit that was developed in 2016 and led by Andy Dwyer in partnership with the National Colorectal Cancer Roundtable and the American Cancer Society at the national level. And it was updated in 2019, but I expect that it'll go through another round of updates in the next year or two. And it's a pretty comprehensive toolkit that contains a set of experience-based examples, case studies, tools, and other resources that are used to help describe the evidence base and quality standards for patient navigation for colorectal cancer screening, look at different payment models and methods for sustainability, and provide resources for developing a business case for colorectal cancer screening patient navigation. So I just wanted to provide an outline of the different content that's available in the toolkit. As Erin mentioned, for the lung cancer screening toolkit, we kind of think of this as a choose your own adventure too, where you can really hone in on the chapters and content that are most useful for your organization, and you don't need to read the toolkit necessarily cover to cover unless you really want to take a super deep dive into sustainability. So it contains a sustainability framework, information about the evidence base for colorectal cancer screening navigation, examples and case studies of different programs at the local and national level for colorectal cancer screening patient navigation, and then those case studies link to the information in the following chapters around payment approaches, different existing quality and accreditation standards that can be linked to CRC screening patient navigation, the steps and tools for going through an economic analysis and how you can make the business case within your own organization, some examples of policy standards and different policy measures that have been looked at to support colorectal cancer screening patient navigation, some of those key measures for evaluating colorectal cancer screening patient navigation and how you could go through your own evaluation of your program, and then some additional supplemental resources. So I did just want to pull out some key messages that are contained in the toolkit. The first of which is that paying for navigation, as many of you know, remains a bit challenging in most states, including Colorado, because there's not typically direct reimbursement. But some programs have been able to successfully make a business case to their institution's leadership based on the cost effectiveness and impact of quality measures that really shows that value to the organization. And programs have also had some success with linking navigation services to existing incentive and accreditation programs like per member per month, CMS's quality payment programs, accountable or managed care organizations, and connection to Medicaid for CHW services and reimbursement. And I'll talk just about that a little bit more in just a moment. But many opportunities still remain to explore additional policy approaches at national and state levels that can further support that reimbursement and payment for navigation. And some of this is ongoing in Colorado. So I did just want to highlight at the national level that reimbursement through Medicaid, and NASHIP did a nationwide survey about different organizations' ability to integrate community health workers, and CHWs is an umbrella here that also contains navigators in many cases to really support them in their healthcare systems. So in the purple, there's 15 states that have been able to get reimbursement for CHW services through the state's Medicaid program. And in many cases, these are Medicaid expansion states. In the dark green, there's states that do not directly get reimbursement for CHWs through Medicaid, but their managed care organizations or accountable care organizations are able to hire CHWs directly or get reimbursement for the services. So that is the case in Colorado. For example, Rocky Mountain Health Plans, their Colorado Access has been able to hire some CHWs directly, but there's still 27 states that have not been able yet to get reimbursement for CHW services. So there really is a lot of need to focus on that payment for sustainability of navigation. However, sustainability is really more than just about money and is a big holistic construct with many different domains that influence its capacity. So with our work with CCSP, we've been able to adapt in close partnership with Washington University, their program sustainability assessment tool, and clinic sustainability assessment tool and planning process, and develop the patient navigation sustainability assessment tool for cancer screening, also known as the PNSAT. And this is really focused on patient navigation for preventive cancer screening, but it can also be expanded to focus on patient navigation services overall. And it is based on 8 domains that I'll go into in just a moment, and takes about 15 to 20 minutes to complete. So the domains of the PNSAT include that funding stability, but are also focused on engaged staff and leadership, organizational context and capacity, engaged community, communication planning and implementation, workflow integration, monitoring and evaluation, and outcomes and effectiveness. And the process to really look at capacity using this tool and those 8 domains is to bring together 3 to 5 individuals to each complete that PNSAT from their own perspective. And then they'll get an individual score report. But you can also take those individual scores to compile an average group score report to help further guide discussion. And then the steps to really look at those results and develop a plan is to bring the sustainability team together to look at those results, what were the challenges and facilitators, and then use that information to set an actionable sustainability goal for the next year based on 1 to 2 priority areas, and then develop that plan for the goal using an action plan template where you can put out those steps and the timeline as well as resources needed, and then use that plan to really go through each of those steps over the next year and pull in external resources as needed. And we see that it's key to re-examine that plan and take the PNSAT again, at least annually, to look at what's changed with sustainability capacity and if there's a need to update the goal and process. So it is really an iterative process. It's not going to lead to sustainability overnight, but by really focusing on those areas that you can change, it helps strengthen overall capacity for sustainability. And some of the clinics that have gone through this process, that it really helped them maintain the navigator role throughout COVID when there are some of those unexpected things that come up. So this is just an example of one of those action plan or PNSAT reports where you have the scores for each of those domains. And so we have the CCSP sustainability for patient navigation specific site where you can access the PNSAT, learn more about it, download action planning templates, and get some additional resources for developing an action plan. And I've also linked that Paying for Colorectal Cancer Screening Navigation Toolkit, as well as CCSP's website where we have additional resources. So that's all of the information I have for today, and I'm happy to take any questions. Thank you.
Thank you, Elsa. All right, any questions? Okay, and we'll be sure with the Zoom reminder, you should have received the agenda, which had all the toolkits linked in it, but we'll be sure that you all receive all the links to the toolkits and can review them as you have time. All right, last call for questions for Elsa. Okay, well, if you think of any, please put them in the chat and then we can address them towards the end. So now I'll turn it over to Allie. So thank you.
Christy, can you see the presentation one?
Yep.
Okay, perfect. So I was really hoping today that we would have a hot off the press toolkit to share with you guys. Many of our colorectal cancer screening toolkits are undergoing updates right now. And we're supposed to be done the end of last month, the beginning of this month, but they are still being polished. So instead, today I'm going to be talking a little bit about one of our most comprehensive toolkits or handbooks that we have for health systems looking to increase cancer screening rate or colorectal cancer screening rates. So as I mentioned, this is called Colorectal Cancer Screening Best Practices. And as you can see from the table of contents, this is definitely a hefty guidebook. So it is 119 pages long, which can be pretty overwhelming, but hopefully, as Elsa and Erin both did, I can break this up into kind of some digestible pieces, and you'll be able to see really how this can help your health system or your clinic to increase their cancer screening rate. So it is divided up into 4 different sections. So section 1, section 2, section 3, and section 4, which you can see each of them all kind of have their specific area that they focus on. And so I will talk through all of those sections here. So section 1 really talks about the 12-step process that many of the health systems, clinics, and hospitals that have used this guidebook have seen to be really effective. So much like the process that Elsa just talked about with the sustainability program, it's also similar whenever you are building the program. And so talking about the business case, looking at your data, designing your program around evidence-based strategies, which all of the examples in this toolkit do use evidence-based strategies that are tailored specifically for their target audience, thinking about barriers and workflows, and then making sure that we're using our electronic medical records to the best of their abilities. So case studies. So one of the things we hear most often is, what have other health systems done? Are there things that we can learn from them, steal from them? The best ideas are stolen. And so this resource really puts together a lot of examples around what has worked for other health systems. So in the case study section, I just grab some screenshots of what this kind of looks like. So you get an overview of the system, the type of system they are, the activities that they did, the resources that they used, and then the impact that the project had, along with some key lessons learned. And then each one of these does really dive into the project that the system undertook and how they changed their processes and everything that they did to implement that evidence-based strategy. And so these are all of the systems that are systems or programs that are featured in the guidebook. And there really are some diverse examples here. So as you can see, they're from all over the country. In the green shade under the health system name, you can see kind of what they focused on, which again is pretty diverse. So lots of opportunities to see what has worked well for other systems. Something else that's neat about these case studies is they show the actual results from the system. So we get a lot of questions around like, if I do implement this strategy, how much is it going to increase our screening rates, our return rates on fit tests? What does that look like? And so for each of these case studies, there is a section with results and data that shows the change that the clinic saw based on the intervention that they chose. And then also, we have a lot of conversations around process maps and workflows. And, what does a great process map look like? What does a great workflow look like? What is kind of a design that will work well for our health system? And so there's also examples of workflows and process maps that were created as a part of these interventions too. So if you're looking to implement a similar intervention, there's an opportunity to really see what a process map could look like for this. So the next section is implementation. So there are some templates to help you in your health system really start to create that action plan to decide, what is in place currently, what do we need to change, what are those challenges that we really need to develop a evidence-based intervention around, and then some other things to consider around outcomes, who's actually going to do this work, and then what information and resources are needed. And then we know that there are also a lot of other toolkits. And like I said, this is a little bit old. And so a lot of these toolkits have been updated or are in the process of being updated. But if there is a specific intervention that you really want to narrow in on, such as fit testing, if you are a community health center or federally qualified health center, there are some additional resources that can provide additional support whenever you're thinking about some unique factors that either your clinic has based on the type of clinic that you are, or based on the specific intervention that you're looking at. We also know that messaging is huge. So pretty much regardless of which intervention, evidence-based intervention you choose, there will be some type of messaging needed. And so this toolkit includes some hyperlinks to some different types of messaging. If you're thinking about like sending an email, or thinking about different messages that resonate with particular populations, which we have done a presentation on that previously that we can share if that's helpful too. So an ACS and National Colorectal Cancer Roundtable guidebook would not be complete without a resources section. And so again, these are examples taken from the case study health systems for what they used as a part of their interventions. So if you're doing community outreach, do you need some kind of questionnaire to see if people actually learned something from your outreach? Are you writing a letter or an email to patients to emphasize the importance of screening? There's templates and examples of all of those kinds of things. And that is a real quick overview. And like Christy said, we'll share the link for the whole document, and you can peruse everything else to see what can be helpful for you in your system. So thanks.
Thanks, Allie. Okay, any questions for Allie or any other questions? Well, we'll stop with that. Any questions for Allie?
And Christy, I'll just say, once we do get the updated versions of some of the other toolkits, we'll make sure that